DEROY Murdock. Democrats plot war on new drugs with $3.5 spending billTotal. Democratic Party control of Washington has yielded, for starters, an Afghan meltdown, bedlam on the border, a bloody crime surge, energy woes, mounting inflation, and racial tension.Next. Stop your medicine chest.Joe Biden, Nancy Pelosi, and Bernie Sanders' $3.5 trillion spending orgy includes a poison pill, almost literally. The Congressional Budget Office estimates that H.R. 3 would help pay for this fiscal incontinence by squeezing $581.6 billion from the pharmaceutical industry over the next 10 years. More than just a simple tax on evil drug companies, this measure would blackmail this sector, chop into its bottom line, and torpedo research and development into future therapies. Down the road, this means more ailments and earlier deaths for everyday Americans. In other words, just another day at the office for Democrats. H.R. 3 would force pharmaceutical manufacturers to haggle over prices with federal functionaries. But this is not the bargaining between buyers and sellers that occurs daily across America. H.R. 3 defines negotiation as Washington bureaucrats dictating an amount that they feel like paying for a drug, based on overseas price controls mandated via socialized medicine. Those fixed prices would regulate all sales to Medicare, Medicaid, and private insurers.
And what if a drug company resists this new policy? That's when federal extortion kicks in. Pharmaceutical firms that will not swallow Uncle Sam's prices would face taxes on gross revenues that start at 65%. But the tribute rises every 90 days that any such enterprise refuses to be bludgeoned. Ultimately, as Biden said at the White House on August 12, it means drug companies would have to sell their drugs to all distributors at the Medicare price or face up to a 95% excise tax. Applied to dating, this is akin to, let's spend the night together. If not, you're free to go home naked but you can keep your shoes on. H.R. 3 must have been written by Democrat mega-donor Harvey Weinstein. This left-wing scheme would rip huge chunks out of drug companies' hides. CBO forecasts that negotiations would reduce prices by 57% to 75% relative to current prices. Of course, even a 75% sales drop beats a 95% cut. This helps explain the Leninist levels of this proposed new tax. Eli Lilly CEO David Ricks projects that this legislation could empty his trade's cash registers by 40%. Healthcare consultancy Avaleri predicts that, across this industry, H.R. 3's price controls could affect up to 550 drugs and slash drug makers' aggregate revenues by $1.65 trillion within 5 years. So, what? If pharmaceutical CEOs must postpone their new yacht purchases or buy slightly smaller ski chalets, they will survive. If only the world were so cartoonishly simple. Punching the drug industry in the mouth gives regular patients bloody lips. If H.R. 3 slices drug companies' incomes, they will have less money to create new and better drugs. The proposals that we're seeing from Congress will devastate this industry, said Merck Chairman Kenneth Frazier. The most difficult disease states, the most risky, the most expensive projects will be at risk, Frazier added. The hundreds and thousands of small biotechs that rely on venture capital investments from big pharmaceutical companies will just disappear. Frazier said of his company, "We have modeled it, and our ability to fund R&D inside Merck will be reduced by almost half. This means empty your medicine chests." According to CBO, the reduction in the number of new drugs entering the market within 30 years ranges between 21 and 59. Even more ominous, University of Chicago professor Tomas Philipson expects H.R. 3 to abort between 167 and 342 new drugs by 2039. A vaccine against the common cold. A pill that stops miscarriages. A cure for prostate cancer. Gummies that reverse Alzheimer's. H.R. 3 could entomb such inventions in their test tubes. It typically takes $2.6 billion and 10.5 years to release a new drug. Why should Acme Laboratories endure such expensive trouble if some Democrat nugget HHS decrees that the fair price is 43 to just 25 cents on each anticipated dollar? In that case, why bother with healthcare innovations? Instead, sell generics, leave work at 3 p.m. and play golf. If passed, this Democrat brainstorm would clear research labs in crowd country clubs. If H.R.3 passes and Congress redefines the word negotiation no longer to mean real negotiation, our critical funding from venture capitalists will dry up, along with our potential to develop urgently needed new treatment options. Joanne Kotz, CEO of Jnana Therapeutics, warned Wednesday at a Washington, D.C. meeting of Incubate, a coalition of early-stage pharmaceutical investors. As a result, we will all lose hope of having better medicines tomorrow than we have today. We'll all face suffering and greater costs from diseases that our research could have averted. As if on cue, Peter Kulczynski underscored Kotz's premonition. If the government can pick any arbitrarily low price it wants, and prevent a company from saying no by threatening it with a ruinous 95% tax, then I could not justify any biomedical RAND-D investment to my investors, the successful venture capitalist declared. In other words, we should expect a near-total collapse of RAND-D funding. Among other innovations, pharmaceutical companies have created drugs such as Avastin and Gleevec that for many have transformed cancer from a death sentence into a temporary headache. Descovy and Truvada are, essentially, AIDS vaccine pills. And President Donald J. Trump's Operation Warp Speed inspired Pfizer, Moderna, and Johnson & Johnson to deliver COVID-19 inoculations in a record 12 months. The cure-crushing H.R. 3 is how Democrats say thank you for these miracles and threaten unseen breakthroughs.
Thank you for watching. Please subscribe.